Okay, this week our injury is sciatica. Now, what we're going to have a look at is what it is, very briefly, signs and symptoms, red flags, which are serious signs, and when to get some help. Okay, so what is it? I'm going to keep it very, very simple. It's basically just irritation of a nerve root in your back, mainly in the lower back, okay? And it's irritation that is driven by either mechanical irritation, so the nerve getting pinched, for want of not having a technical term, and then equally local inflammation. So it doesn't actually have to pinch on the nerve. There can just be an inflammatory response that causes irritation. Okay? Signs and symptoms. So basically, what does it feel like and how does our function act? We've got back pain, obviously. We usually get associated pain down the back of the leg. Okay? Weakness, numbness. So basically, do you feel weak when you're walking, or do you feel like you're struggling to push out of a chair? Things like that. Numbness would be just loss of sensation a little bit down the back of the legs. Then I've got here peripheral versus central. Now, peripheral would mean that the pain is going right the way down the leg up to the underside of your foot. Okay. Central would mean that it's coming closer towards the back. That's what we want. We want our pain over time to start to centralize. Okay. Then we have more sort of red flags. Okay, so red flags is very, very serious signs, and we want to take them very seriously. So if you are getting any of these, then please do seek medical attention instantly, really. So we've got issues with your bladder and bowel. Okay, it's a bit of an uncomfortable question to ask, but if you're struggling going to the toilet or struggling, to hold your wee in or other stuff, then do go get some help. Okay, constant night pain, so it's completely unremitting. You're really, really struggling with it. It's just not going away. Okay. Then we can have complete weakness as opposed to a little bit of weakness. So there's a difference between feeling a bit weak and then equally not being able to lift my leg or not being able to push my foot off the floor. Okay. And then there's lots of others, things like previous history of cancer, but we're not going to go through every single one because we'll be here all day, and that's another video. Okay. And then we've got when to get help. So for me, advice around sciatica is always beneficial, okay? It's always helpful to go see someone because we can help with your aggravating and easing factors, because sometimes it's really, really hard to find what irritates it and what doesn't, because everyone's a little bit different. Equally, if your pain is not centralizing like we discussed before, so over time, week by week, your pain is still staying right the way down the underside of your foot, that's not a good sign, okay? And then equally, obviously, if you're getting any of these serious red flags, that's really, really important to go seek some help, okay? Okay, if you need any help or advice, do please give us a call. We're always here to help.